Guys, welcome back to Medical Coding with Blue. Today's episode is all about tips to pass the medical coding certification exam. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so today's message applies to the CCS, that's the Certified Coding Specialist, the CCA, the Certified Coding Associate, the Ccs-P, the Certified Coding Specialist Physician-Based, and the CPC, the Certified Professional Coder. Any one of these four, okay? Because these are the four main medical coding certification exams. Now, these tips today, again, they cover all of those. I have done several videos about study tips. I've done several videos about the books that I recommend. But this video today is going to be the overall thing, okay? Because I've been getting quite a few comments from folks lately saying that, well, I barely missed the passing score. And so I failed, but I was really close to passing. And I get that a lot, especially from my folks that are sitting for the CPC exam. And they're saying, well, you know, I was just right there and I just didn't pass, or I've taken my test 3 or 4 times and I'm still not passing. Blue, what am I doing wrong? So when you are preparing for these exams, and whether you are preparing for 3 months or whether you are taking the time throughout your whole program to prepare so that you can take your test right away as you complete your program. The thing that you have to remember is all of these books are going to go into the exam room with you, okay? Or whether you've taken it at home, right? For my AAPC folks, they can take their exam at home. If you're taking an AHIMA exam, the CCS, the CCA, the CCS-P, all of those require you to go to the Pearson VUE Testing Center. But all of them, you take the books in there with you. So these are open book exams. The thing that I see a lot of people miss out on is getting to know their books. And the people who tell me that they just barely missed that passing score are the people who, when they show me their books are just filled with tabbing, and then they're going through it and they're showing me all the writing and stuff. These books do not have to be written in. These books do not have to be written in. These are written and put together by doctors, by scholars, by other professionals. It has literally everything that you need. You have to learn to trust the book. You have to learn to use the book. And that's the problem. There's a lot of these fast-paced medical coding schools that really push, tabbing your book, writing in your book, and doing all these things. It doesn't need you to add anything to it. What you need to do in order to be confident and in order to pass your certification exam is to practice. And for those that want to sit there and cram in 8 hours in a day and then do a 6-hour stretch, or do, Blue, I studied for 10 hours all in one sitting, that's setting yourself up to fail because it's stressing your brain out. You have to learn to work with a schedule, and you have to learn to get the time in, and you have to be responsible with your time. So what I mean by that is studying for 30 minutes or 1 hour at a time. Either one, okay? So 30 minutes or 1 hour, so that way your brain can have a rest in between. If you go for an hour, make sure you take a 15-minute break, and then you can come back to it, okay? So however you want to do that, but you take that 1 hour and maybe you're working through the workbook, or maybe you're working through, looking through the book and then working out some of the things like to get familiar with the areas of the book. There's a lot of things that people miss out on. And in some of these books, the books that I recommend come from Optum, as far as like the ICD-10-CM and ICD-10-PCS. Those all come from Optum. Even the HCPCS book comes from Optum, the ones that I recommend. And for the testing, you have your choice of publisher when it comes to the ICD-10-CM, the ICD-10-PCS, if that's required for your exam, or the HCPCS book. You have your choice of publisher, all right? And if you're looking at the website, AHIMA has the specific IBSN number for the books that they say are okay, but you do have your choice. The thing that we all have to have, though, is that AMA CPT Professional Edition. For all 4 of those exams, we all have to have that book, that specific book. And I'm not going to show it again because I know it's backwards. But the thing is that I want to say, it depends on the book that you have as well. Your tools that you use during this exam are going to make a big difference, all right? So if you're using the Optum books, I know personally that all the information is there. It doesn't need anything written in it because it has so much in it. The ICD-10-CM has at the beginning of every single chapter in the tabular section, it has a breakdown of that particular chapter and how to apply those codes. And so all you have to do is cover up the answers because it gives you the answer and the rationale. Cover up the answer and the rationale and read the question, look up the codes so that way you can get practice in the book. And if you're looking for, I want to code, big op notes and big op notes and big op notes. If you don't know how to spot diagnosis codes first, if you don't work through something like the Optum ICD-10-CM book, if you don't work through that and get to recognizing that sometimes there's encounter for codes that are listed first, or it's aftercare or attention to, like, an osteotomy or whatever. If you don't recognize those things, reading big op notes is not going to help you. All right, because you're going to be so lost and not know where to go. So that's why I say do the work in small batches so that way you can build up your knowledge. Working through the ICD-10-CM expert for physicians from Optum by covering up those answers and working through looking up those codes is going to help you a lot. If you have the CPC study guide, and that is good for even AHEMA exams because we all use the same CPT book. So if you study with that CPC study guide, it's going to help you because that book is written so well that it breaks down like all of these big op notes and things like that. So you do get those practices in there, and it has great questions, and it also covers your anatomy and your physiology, your pathophysiology as well, medical terminology. So it's a great all-in-one book. I do have the link for that particular book in the description box below. For the diagnosis coding and for the ICD-10 PCS coding, there is always the ICD-10-CM and ICD-10 PCS coding handbook with the answers by the American Hospital Association. Nellie Leon Chizen is the one who wrote that book, and that is a fantastic book as well. So if you are looking to beef up on your diagnosis coding or your inpatient procedure coding, if you're taking like the CCS or the CCA, you can work through the ICD-10 PCS portion of that book. Or if you're just taking one of the outpatient exams like the Ccs-P or the CPC, you can skip over the ICD-10 PCS questions and go straight for the ICD-10-CM questions. But the only way you're going to be able to pass these exams is to practice, practice, practice. Practice for 30 minutes at a time, practice for 1 hour at a time. Get that 20 hours in. There is no excuse. There is no excuse. If you tell me, Blue, I work 40 hours a week, there's plenty of people who work 40 hours a week, who have a bunch of kids, who have farm animals, who have all kinds of activities that they have to be responsible for, and they still make the time because you can squirrel in that time. And having that repetitiveness of looking up the codes and working with the book and being so confident when you're looking through the book because you've gotten so much practice with it, it's going to go a long, long way. And if you have if you're taking the CCA or the CCS and you have the ICD-10 PCS version from Optum, in the back, it has Appendix M and it has questions and answers. It's got all these procedures that you can look up that you can practice through. If you're taking either one of these, the CCA or the CCS, I recommend you work through that entire list of all of those procedures to look up. You work through all of that so that way, once you work through all of that, trust me, you'll be so confident with that ICD-10 PCS book, and then it will come easier to you, and then taking the test will be no big deal because you'll be so confident using these books. People who are not confident with the books, or people who complain about the books, I hate them, they're so big, rah, 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 I don't like them, rah, rah, rah. This is our life, guys. This is what we do. We work with books. Books aren't going anywhere, okay? We're always going to need them. And even if you get into the real world, when you're working, and you're working with an encoder, which is an electronic code book, when you're working with that, it's still nice to be able to bring a book to a provider so that way you can show them in black and white, this is where my information to you is coming from. It's not just me, the coder, making it up. This is literally coming from an official source. So that's why it's important for you guys to stay on top of working with your code books. But the only way, again, that you're going to be able to pass, it's not trickery, it's not highlighting, it's not writing, it's not circling, right? Circling all the procedures, the parent code and the child code. Is not doing any of that. It is literally practicing with the book, because that circling is time wasted that you could have been looking up codes and practicing looking up those codes and applying modifiers and looking at the appendixes to see where they are and the information that it holds. The CPT book has the appendix A is the one for all of the descriptions of the modifiers. And I can't tell you how many people have told me, Blue, I did not know that was there. That's a shame, especially if you have been in school that whole time and you still didn't know about that. You know, in the inside cover of the CPT manual, there's all the modifiers listed and where they apply. And so that's the thing. You will know those things if you're working and practicing with the book. And that there's no secret to passing the exam. It is literally good old-fashioned hard work and reading and looking at different videos. If you feel like you're stumped on surgeries, then I recommend that you go to YouTube and you Google or you YouTube the surgery that you are so confused on. I had a rough time in the beginning when I first started out with meniscal surgeries, right? For surgeries on the meniscus of the knee, right? So I had to look those up. But once I did, just listening to them talk about the equipment that they were using, the tools that they were using, where they were going in and what they were doing and using the trocars and using ports and all this other stuff, then everything made more sense to me. And it can make more sense to you, okay? So that's the thing. The other thing that I want to talk about is not playing that, it's going to sound mean, but it's not mean. If you're really serious about medical coding, then you're going to understand what I'm saying. If you are playing this card of my teacher didn't teach me, my school didn't teach me, my school this, my school that, my teacher was horrible, this and that, not everybody's meant to be an instructor, guys. Not everybody is. And sometimes people find that out the hard way. But it's okay. We can learn medical coding on our own. And it doesn't take, the fact that, that they were really bad and, I gave up and things like that. Don't give up so easily. Don't give up so easily, because that is just a waste then. It's a waste of talent. It's a waste of, your resources as far as like financial or even with time. People don't think about, wasting time. Time is very precious and life goes by just like that. Life is very fast. And if you are sitting here piddling around and wanting to just have a pity party and say, well, it's because my teacher didn't teach me and this and that. Okay, then take back your power and go find a tutor that can help you. There's a ton of tutors on LinkedIn, guys. There is a ton of tutors on LinkedIn, and they're all different price ranges and everything like that. So there's some that, if you find one that's really helpful for you, that you really like that person and you have a good connection with them, then that's great. But the onus of passing these exams is on you folks. And it doesn't matter the program that you go through, especially when there are free resources out there. The independent study list, where I have given you guys the whole list of all the books that you need and breaking down the time as far as like how long to spend on a subject. And you can use that to augment your program. And I give this to y'all for free. I don't ask anything for it. So, it's out there. There's plenty of resources. But then when I see these people that they just want to just have a pity party because their teacher was so bad and things like that, but they're not doing anything proactively to make themselves a better coder as far as like, okay, that didn't work out. So let me find somebody, let me find a tutor so that way I can learn and it can, somebody can help me to understand because my teacher didn't. If you're not doing that, guys, that's where you're stuck. You're always going to be stuck if you do that. But be proactive. And I've had many students come to me where they said, well, Blue, I just didn't learn anything from my teacher and I really need help. Those are the people that I admire, because they're reaching out. They know that they're stuck. They know they need help. So they're doing exactly what they need to in order to be able to succeed. And there's been many of them who have written me and said, Blue, I passed. There you go. And it has everything to do with how much you are committed into learning, how much you are committed into taking this seriously. Because sometimes people, they get all sucked in because of the money, and they're like, ooh, I'm going to do this, and I'm going to do that, and I'm going to make all this money, I'm going to work at home, I'm going to do this, and, oh, it's going to be this fabulous life. But then when you get into ground zero and you're having to sit there and work, you're actually having to learn all of this stuff, because we have to know what doctors know while never having gone to medical school. When you have to sit here and learn all of this stuff, then it's just like, oh, I didn't know it was going to be this hard. What did you think it was? There's a lot of privilege that comes with this line of work. There's a lot of privilege that comes with it. There are so many things that you can do with it. But if you, again, are not looking at all those things and you want to be fixated on the fact that your teacher didn't teach you and this is why you're failing, let go of that, guys. Let go of it, because it's done and it's gone. If you really want to pass, this is how you pass. You study. You literally open your book. You literally get those workbooks. You work for 1 hour at a time, or 30 minutes minimum. And then you take a break, and then you come back to it. And then you start opening your books again, and then you start looking at all of the pages. You read the coding guidelines. And you can actually listen to the coding guidelines as well. A lot of people don't know this. You can go to Microsoft Edge, right? You use that browser to open up. And if you go and you download the coding guidelines from CMS, and I will leave it in the description box below, the link for it. So that way I don't have to get the question. Although I know I'll probably get the question. But again, it's your research, guys. Okay, I will leave the link for that ICD-10 2023 guidelines in the description box below. But open it there through Edge, and it'll read it aloud to you. All you have to do is click on a word, and then it'll give you the little ellipsis, the 3 dots, and then you say read aloud, and it'll read aloud to you. So that way you can listen to the guidelines. And if you're cooking and doing all this other stuff and messing around with the kids, or doing something in the yard or whatever, you can listen to the guidelines. And you don't have to understand specifically what the guidelines are saying, like fully, but you just have to kind of know, okay, this is where it is. I heard this. Somebody told me this. I learned this somewhere. And then you're going to be able to trace it back to those guidelines. But listening to them is going to help you so much, because again, it's going to give you tips on, what applies and what doesn't apply, and about sequencing, and about, just different conditions, because it covers the entire book. Okay. So knowing the guidelines is very important, but practicing is also important. So stop trying to sit here and write all over your books, graffiti all over them, or tab them to heck and gone, or doing all those things, rather than wasting that time and doing that ridiculous circle method. And I'm going to call it ridiculous because it is. If you can't see that there's an indentation, really, but stop wasting time on doing all that stuff, and just actually get in there and start looking up codes. And then if you say, well, Blue, I don't know how to look it up. Okay, then find a mentor or find a tutor, somebody that can help you and get you going in the right direction. Because that's all it is. It's just you talking and being able to say, I need help. I need help. And that's it. That's it. But if you consistently spend 20 hours per week when you're studying for your exam, maybe it's a month after your program is complete, or maybe it's up to 3 months. Because I recommend, if you were in a decent length program, like one that's 9 months, 12 months, or 18 months, and you want to take a month to up to 3 months to take your exam, that's perfect, because that time is going to give you so that you can either save money if you need to save money to pay for the exam, or if you need to spend a little bit more time trying to study and things like that. That's okay. That's that time. But try not to go past those 90 days, because then you're going to start to forget things. And then all of a sudden, one more month, or let me study for another couple of months, and that's going to turn into 6 months or a year later. And you don't want that, guys. You want to be proactive. You want to get with these books. And yes, that's all I'm saying is get with the books, read the books, work through the workbooks, work through looking up the codes. Because again, that's as simple as it is. That's it. There's no big secret to it. There's no hidden agenda. It is just you and the books. Now stop being so difficult on yourself as far as like, oh, I have to cram and I have to neglect my family. Don't do that, because you don't want your family to not support you in this journey. You really do need to have a good support team around you. That's very important. But if you don't have a support team, or if you feel like your family does not support your decision to do this, it's okay. It's okay to chart your own course. It's okay to believe in yourself enough to say, you know what, I don't have to have somebody around me cheering me on. I can do this. I can do this. If you need motivation, trust me, I've covered that on my channel too. But guys, that's all it takes is working through the books and giving yourself the adequate time, spending those 20 hours per week studying, okay? And again, studying no more than 1 hour at a time, taking a break, getting back to it, and then, working it out. And if something is frustrating you, put a pin in it and just move on to the next subject. Come back to it when you have rested, when you have recharged your mind, and then you can look at it again from another point of view, okay? And there's those options of doing that. But don't stay stuck on that hamster wheel of my teacher didn't teach me and that's why I failed, and I have test anxiety. Stop those things. Those are self-destructive things and they're unnecessary, especially when there are so many things that can help you out there. These books literally can help you, but you have to be the one to sit there and say, okay, I'm going to do this. And you don't need anybody's permission to want to do good things for yourself or your family. If you are pursuing medical billing and coding, I'm going to say this and I'm going to wrap it up. If you are pursuing medical billing and coding because you want a better life for yourself, you want a better career, but you feel like this test is stumping you and you feel like, everything's against you to do this. No, it isn't. It's just you spending too much time thinking about other things instead of getting with the books. Get with those books, especially when you start to feel that overthinking taking over and saying, oh gosh, can I do this? Can I do this? Yes, you can. Yes, you absolutely can. There is no reason that people walking into these testing centers or even testing with the thing at home, there's no reason that you shouldn't be confident and being able to say, you know what? I've been studying. I did the 20 hours per week. I got this. I can do this. I know these books like the back of my hand. I know them forward and backwards. I didn't have to memorize. I didn't have to do any of those things. But I worked with them frequently enough that it's not going to be a big deal when I get these questions. And I've looked at all of these other resources that are out there on Medical Coding with Blue's channel. And I've looked at those books. I've gone to the public library and I've checked out books and done all these things because the public libraries are open now. So you can get a bunch of resources from there as well, guys. Those are things that, you should take advantage of in your local area and just be able to do those. And people have told me too that they found free coding classes, medical coding classes at their local library. And I thought that was amazing. But they did, and they were able to. So get your confidence, guys, and do that by doing the simple action of just working in the book. There's no frilly big show about it. It is literally trusting in the books, working through them, working through those workbooks. And if you get stuck, find a mentor, find a tutor, somebody that can help you, coach you to get you through those things. And that way you can be a successful medical coder like you want to. But it's going to take hard work, but I know that you can do it. All right, so I'm going to wrap this one up. Thank you so much for joining me. Tomorrow is Friday, the 23rd, and that is my once a month live. So I will be live tomorrow on the 23rd. I will see y'all at 5:30 p.m. Pacific Standard Time, 7:30 p.m. Central Standard Time, and 8:30 p.m. Eastern Standard Time. I will see y'all then. Bye.